Hello and welcome to the Dementia Doctor. Now, this video is a part of my series on Symptom Spotlight. What are the most common difficult behaviors that my families tell me about, and what are some of the symptoms that the caregivers truly struggle with when they are caring for their loved one with dementia? Now, of course, when I talk with my families and when I say what really triggers their agitation or anger, number one thing that I hear over and over is when I tell them to do something. Now, this is it brings a smile on my face because it's something that we all experience. We know what are good things for us. We know what to do, but if someone tells us to do something, that sometimes doesn't feel good, especially if it is coming from our loved one. If it's coming from our spouse, we might get a little triggered. So this is something that also happens with our loved one. And one of the very common times agitation happens is around the bathing time, is around the bath time. So let's talk about what happens when our loved one is refusing to take a shower or bathe and what to do in that situation. So first of all, let's kind of think through what is going on. Why do they not want to take a shower? So if you have seen your loved one who is experiencing memory issues, they often get overwhelmed easily if your surroundings are not clean and if there's a lot of sensory stimulation that they are getting. During the bathing times, there is a lot of sensory stimulation. You're in the bathroom, you can feel the water over your body, you see the lights. It's just a lot of sensory overload. Secondly, also, it is a private matter and there is some degree of vulnerability that comes with bathing and dressing. So your loved one also probably feels a little violated or they're feeling that this is such a personal matter. How come you're telling me what to do with my bathing schedule or my showering schedule? The other thing that plays into this issue, especially with dementia patients, is what I had earlier made a video about, is the lack of insight and anosognosia. That is, that I lose the insight into my own issues, and that might also play a role because they lose the insight that they are unable to now track and monitor their own hygiene. And when someone else brings it up, it feels like a violation of their personhood or violation of their personal issue. So those are a few reasons. Now there could be other reasons, just sensory reasons, like someone might have neuropathy. Individuals with Lewy body dementia often also experience depth perception issues. So it could be physical discomfort, as we talked about, just the sensory overload. It also could be just kind of thinking about a violation of someone's privacy, and it is a sensitive topic. And last but not the least, as we discussed, nobody likes to be told this is what you should be doing. Absolutely nobody. So that's the main core of the problem that typically happens around bathing time. Now, if you think about it through the eyes of caregiver, they have so much to do. And in addition to doing so much, they also have to make sure that the hygiene of their loved one is good, and they also have to give them a shower, which by itself is a very physically and mentally challenging activity. So they might come on a little bit more frustrated, and it might not be even in what they say, but in their tone, in their body language. And for a loved one who is suffering from thinking and memory issues, they can often pick up on these subtle cues that are nonverbal, and they might be responding to those cues that you unknowingly, unwantingly are expressing because you have so many things on your plate to do that day. So So what can we do if our loved one is refusing to bathe or shower? Well, the first things first. So we can change the terminology a little bit. Showering and bathing seems like a very personal activity to do. And if we change it to other terms, such as a spa treatment, a massage treatment, a facial, a manicure and a pedicure, this might open up our loved one to an activity where someone else could be with them. So when we say, well, mom, let's go for a spa treatment, I would really like for you to enjoy the new candle that I brought, and we'll then use the lotion with the favorite fragrance that you really love. So oftentimes changing the term from bathing or showering or you need to clean yourself helps, because sometimes I have families when there has been enough push and pull around that. Sometimes the individual who's suffering from memory loss is just now getting triggered by those words. So if you are noticing that even those words are triggering your loved one, then you can just change the words to better or to other words which might not be triggering them. Again, the other thing is your choice of words. So if you say, well, you're so gross, or you haven't taken a bath in 2 weeks, you're so dirty, I can smell it, this is making me uncomfortable, this is so unhygienic, this kind of will not help you or them, because this kind of puts them in a place of shame and embarrassment, and they find it difficult to process that, why is my daughter telling me all this? Why is she getting into my business? I can shower when I want, and if I don't want to shower, I won't shower. So it kind of gets you into this back and forth communication loop, which will not solve the problem. Secondly, it's also about how you frame the questions. So in my other videos, I've talked about it. Open-ended questions like, Mom, do you want to shower or take a bath, are very confusing for our loved ones who are having memory problems. Instead, if you frame the question as a choice, it first of all gives them autonomy over what they want to do, and it could also be where you direct their attention to the choice that works in your favor. So you can say, do you want the spa treatment now or in 10 minutes? That way, they get the autonomy to choose. The answer is in the question is already yes. So they will say yes, but they might say, well, in 10 minutes, I'll be going with you for the spa treatment. So oftentimes just framing the question differently helps you and your loved one to get on the same track together. Now, what are the other things that we can do for making sure that the whole bathing experience is safe and a pleasant experience for both of you? So first comes safety. So make sure you have a shower chair, and if possible, you're not asking them to kind of step in the bathtub. Standing showers are easier, or having a shower chair is almost always very helpful. In addition, having the guardrails or handrails are really helpful so that they can grab onto the things as they are sitting and standing from the shower chair. And also think from the perspective of the things that we talked about earlier, sensory overload. So not having a lot of items on the bath counter or in the bathroom, just having their soap as well as moisturizer is enough, because just visually, if there are too many things, that may also agitate your loved one. The other things that we can do right before shower is, instead of you disrobing them or starting to open their clothes, say, let's start with taking our jacket off, and also having them to be a part of the process. So say, oh, can you help me open that button, Mom? And she will feel included involved and also have a control over what's going on. So with the shower, it's useful to also take it step by step, have them seated in the shower chair, and if possible, get a shower head, because that could be directed to different parts of the body. Now, oftentimes the showering is a whole process, so you can ask them to, if they prefer, to keep the rest of the body covered in a towel, or they can wear a bathing suit, or they can be in their underwears while you start washing their legs and hands. And this kind of also allows for privacy. It's a good idea to start with the feet or the hand and just start with keeping the shower head there and asking how they feel the water feels. Is it a good temperature? Is it too cold? Is it too hot? And that way they feel that they're not just sitting there to get washed by someone else, but they have a say. Secondly, with individuals who have neuropathy, the sensation can feel different from what you are feeling. So what is appropriate temperature for you might be too hot for them. So it's a great idea just to put the shower head at their feet and put the water on and ask them, Mom, how does that temperature feel? Do you feel it's okay? And she may say, oh yes, that feels okay. And then you can proceed to washing the legs and kind of going from there. It's also a good idea to ask them for their help and say, well, can you help me put the soap all over? And then, I'll direct the shower there, so that again, throughout the process, they know what is happening and they are participating as well. So they feel included. Again, when we communicate, it could be small, simple phrases. So if we have multiple steps for the showering, if you say, well, we'll do this, and then we'll go for this, and then I'll apply lotion and this, that might be, again, too overwhelming for your loved one. So just take it one step at a time, but try to kind of warn them what you're trying to do beforehand, before you take any step. So for example, if we're taking the clothes off, we can say, okay, let's start by taking your t-shirt off. And then you can touch their clothes or say, do you want to help me with that, Mom? And she will be starting to help you with that. Similarly, okay, let's sit down on the shower chair and let me first check the temperature for you, if it is a good temperature for you. So if we kind of preface by saying out aloud every single step, they're not anxious sitting there thinking what's going to happen next, especially because it's such a private activity. Our loved ones, even when we know them and have done this activity with them, they still understandably can feel anxious. So it's a good idea to talk with them step by step. I also know of some caregivers who would actually put on the bathing suit and get in with them so that they feel comfortable and they feel relaxed and they feel okay to be taking the shower. Now, let's say you change the terminology to spa or manicure, pedicure, or a facial, and still we are running into issues where the loved one is just adamant that they're not going to do it. So say everything fails. In that case, you have three alternative things to do. You can use a sponge bath, just a warm sponge bath. You can use the bath wipes that come with, already having soap in them, and you don't need to put water for that. Or you can have the top and the tail approach. So you could go for kind of cleaning the hands and the armpits, and with the legs and the groin, just hitting the most important parts in respect to hygiene. And the way to kind of incorporate the armpits and the groin could be, we start with a manicure or a pedicure, and we slowly clean and wipe everything down, and then we put in their favorite lotion, and we can also follow it up with a massage. Now, with all of this, I do want to put a plug in for caregivers. So, a lot of times, because bathing and dressing is so taxing both mentally and physically, individuals will hire someone to help their loved one with these activities. And typically, that's how most of the caregivers start their kind of they are first introduced in the home, because most of the times the family members will say, well, the rest of the things I can do, but this is the time that really takes a large amount of time from my day. It's really taxing, so I think I need to bring in a caregiver. So if you're bringing in a caregiver for the activity of showering and dressing, then typically it does help to bring in who is the same gender, because it may be very difficult for a loved one to see someone from the opposite gender coming into their personal space and cleaning and touching them. So it typically does help to bring in someone from the same gender. Secondly, I say if you are bringing in someone for this purpose, make sure you introduce them in gentle manner. So, make sure your loved one sees the caregiver first time in your presence, so that if they feel unsafe or if they are like worried, who is this person, they can look and they see you and they feel reassured that, okay, probably I'm safe in presence of this new person, the caregiver, because my spouse or my person who takes care of me is here and I'm safe. So, and it's also a great idea to first introduce them just with some kind of activities like folding the laundry or seeing them outside of the bathroom setting. Because if you introduce a stranger to your loved one and then the stranger comes and starts disrobing them and then takes them to a restroom, that might escalate the situation, because your loved one might get confused, they might feel violated, they may feel vulnerable, and actually this is one of the most common reasons for agitation. This is where a lot of physical and verbal violence happens when I see families. So this could be easily prevented by very slowly introducing the caregiver. So it's possible that you might have to arrange a few meetings where the caregiver is just kind of giving them some massage and helps with some manicure or some pedicure. And your loved one sees the caregiver in your presence, starts to learn that I'm safe in the presence of this stranger, and then you can proceed to the act of showering or bathing or putting the clothes on. So hopefully this was a helpful video. I'll see you back in the next video. Till then, take care and goodbye.